it was hanging out about 3 or 4 inches, twirling around. Oh my God, it's a worm.
No.
A worm?
and-
Get it out! Get it out!
A young woman rushed into the emergency room, coughing violently without stopping. What happened next would stay with the ER doctor forever after 12 years in medicine. The patient had been coughing for several weeks. Her primary doctor diagnosed it as asthma and prescribed an inhaler, but the medication did nothing. Dr. Marquette was about to listen to her chest when the woman suddenly turned pale. She said she needed to use the bathroom. Minutes later, a nurse ran back in a panic. The nurse reported the patient felt something moving inside her rectum. Dr. Marquette assumed it was just hemorrhoids. But what the nurse said next stopped him cold. Hemorrhoids don't move. He rushed into the room and had the patient lie on her side for examination. When he saw what it was, he froze completely. A flesh-colored object the thickness of a pencil protruded 3 to 4 inches from her rectum. It was writhing wildly like a snake. This was a living parasite. After learning the truth, the woman broke down completely. Hysterically screaming, she begged him to pull the worm out. But Dr. Marquette couldn't do it. Some parasites have barbs and suckers. Pulling forcefully could be fatal. First, he needed to identify the species. He immediately contacted an infectious disease specialist. The expert confirmed it was a roundworm. Even worse, the patient could have dozens inside her body. The truth was even more horrifying. In Africa, she had eaten food contaminated with parasite eggs. After hatching in her intestines, the larvae burrowed into her bloodstream and traveled to her lungs. Her weeks of coughing weren't asthma at all. It was the worms crawling through her lung tissue. Each cough brought larvae up to her throat. Swallowing them back down allowed the parasites to mature into adults in her intestines. The cycle repeated endlessly. Dr. Marquette prescribed antiparasitic medication. The drugs would slowly kill the worms so her body could expel them. The patient needed to take the medication for 2 consecutive days. Then repeat the treatment 3 weeks later. Unhatched eggs might still remain in her lungs. But there was one detail he didn't dare tell her. The specialist had specifically warned him on the phone. If the patient was taking certain other medications, the agitated worms would try to escape. They could crawl out of her mouth or emerge from her nostrils.